My name is Dr. Domenick Sportelli. I'm a board-certified psychiatrist in both adult and child psychiatry. Anxiety is a big topic. So, most importantly, we want to pay attention to experiences that you might be having with how you view the world, right? Remember, anxiety is important. It serves a purpose. It's like physical pain. It lets you know that something's wrong. The issue arises is when someone has an oversensitive alarm system, so to speak, and they start to become anxious or worried over basic things that normally don't pose an immediate threat.
In crisis situations, I have these anxiety attacks and I hyperventilate and I pass out for a moment.
So when anxiety becomes a problem, it becomes chronic and it starts to affect your life in a negative way. And let's talk about it as a pain metaphor, right? So everybody gets anxious from time to time. So pain-wise, it's like you stub your toe. Ouch, that hurt. I just stubbed my toe. Let me look at it and make sure it's okay. I'm gonna put a Band-Aid on it and it's gonna heal.
Ouch, baby. Very ouch.
Now, sometimes people get anxious from time to time if they have a presentation or, if they have something coming up where there's a lot of expectation or anticipation. Certainly normal to be anxious. If we use the pain metaphor, chronic pain, like my stomach hurts every day, something is wrong. Well, you know what? You're right. You need to check into that and address it because it's affecting your life in a negative way. That's different than a stubbed toe. So anxiety is the same way. I want you guys to think of it the same way. If you notice that you have consistent restlessness, fatigue, decreased concentration, continual worry about things, what behavioral health specialists say is what if thinking, what if this, what if that? We call it catastrophizing, jumping to conclusions, sleep disturbance, and excessive worry for more days than not, which is pretty significant, over the course of a few months, then we're going to consider an anxiety disorder that needs to be treated. And again, it basically means that your sense is a little tuned up and we need to bring it down just a bit. Now, there are various ways to treat anxiety, and there are also different types of anxiety, right? There's social phobias, there's actual phobias like being afraid of spiders. There's lots of panic disorder is another type of anxiety, but generalized anxiety disorder is very common, and that's sort of what I just described. But know for sure that there is absolutely tried and true empirical and verified treatments for anxiety, and it doesn't always have to be medicine. First step could be great psychotherapeutic intervention, and cognitive behavioral therapy works really, really well. Desensitization training works really, really well for anxiety, as well as some medications. If it gets to the point where you need a medicine, we also know that our medicines can help us quite a bit too. So in a nutshell, that's what general anxiety looks like. And if you're experiencing these emotions and feelings and it's happening over a few months and it's not going away, well, that's that chronic pain that you want to get looked into to make sure it's not something deeper. So sometimes it's hard to know where to go for help and to even know if there is a problem. Well, guess what? If you're asking the question, you're in the right place and you're starting the right way because you're asking the question, is there something wrong? Now, if we're specifically talking about, let's say, anxiety, and you find yourself worrying excessively, you're doing a lot of what if thinking and catastrophic thinking, and you find that it's affecting your life in a negative way, well, where do you start? Well, I would say one of the best places to start would be to talk to a professional, honestly. There's so much information out there, and we can jump on the internet and we can find a lot of amazing information to get the basics. But the truth is, until you talk to a therapist or professional, either a psychologist, a psychiatrist, a psychotherapist, who can really assess what's going on in your life by taking a thorough history, a family history, a social history, a genetic and medical history, then they can sort of tease out for you what you might be experiencing and lead you down the path to recovery and give you a plan, a therapeutic plan to help you moving forward.
Right. How does that make you feel?
So first and foremost, if you have a question and you're concerned about a behavioral health disorder, whether it's anxiety or sadness or depression, I would absolutely say look for a behavioral health professional. Now, this could be a psychotherapist or a psychiatrist. It could be a licensed clinical social worker. It could be anywhere from a master's level degree to a doctorate degree in behavioral health. But I would start there. I would really look for someone that you feel comfortable talking to and get the appropriate guidance from a behavioral health professional. If you can't find a behavioral health professional, another great way to start is your primary care doctor. You can absolutely go to your pediatrician or your primary care doc, because those docs also get some training in psychotherapeutic intervention and where to guide you and make the appropriate referral based on the symptoms you're having. So visit a professional and they're going to guide you down the right path. So anxiety in kids is pretty prevalent, but it could look kind of different in kids than it could in adults. So what should we look for? Here's the thing, guys, children don't have the cognitive ability, the thinking ability, and the emotional development to express themselves the same way that adults do. And for that reason, their anxiety could present differently and could look differently to you.
So, how was the first day of school?
It was fine, I guess.
So, a couple of points that I want you to pay attention to as parents and caregivers to see if your child might be experiencing anxiety. Number one is, we've talked about this a little bit in the past, but this is a really important one. Children present somatically, and that word somatic means physically. So children that have anxiety very often present with stomach aches, headaches, restlessness. Sometimes it's behavior like clinginess, but a change in their behavior or a change in their physical symptoms. Another thing is that children can't verbalize their emotions very well. So children cry, children whine, and the other thing kids do is they can become really irritable and have some behavioral problems. Now, instead of just jumping the gun and assuming that you have a poorly behaved child, you might want to think through, wow, they might be experiencing a behavioral health issue like anxiety. So definitely put that on the checklist. A couple of other things is children can exhibit anxiety in different ways, and a few ways that we might see that as parents is, number one, is separation anxiety.
There we go. All right.
All right.
Okay. Ow.
Come on, let go, Mom. Let go, Mom. Let go.
Let go.
Oh, wow.
And separation anxiety means that your child has a really hard time going out on their own. And this could start at a very young age, literally 2, 3, or 4, and go all the way up to adolescence and young adulthood, where they really have a hard time separating from what they feel safe with you and the family. So if you notice separation anxiety, that's certainly a clue that there might be a deeper anxiety issue. Sleep disturbances are a big one too. We've talked about that before. Pay attention to sleeping habits, too much sleep, not sleeping enough, not being able to fall asleep at night, needing comfort at night, extra comfort at night, needing co-sleeping. Experiences like that, especially if they're young, might indicate that there's an anxiety issue. Pay attention to their school performance too. That's a really good indicator, because when children are anxious and having a hard time emotionally, their attention and concentration and interest in schoolwork goes right out the window. So think about a couple of those things when you're assessing, I wonder if my child is experiencing some anxiety. So how do we talk to our kids? Now that you know what to look for and you might be seeing some of these things, what do we do? So time and place are really important. Obviously, don't talk to your kids when they're experiencing an anxiety episode or having a panic attack or feeling really uncomfortable. That's actually not the time to really address it. Comforting them, letting know that they have support at that time is paramount, but you want to approach their anxiety when they feel comfortable talking about it. So first and foremost, you're going to validate their feelings. You're going to let them know that having anxiety is a very normal part of life and can sometimes be good in a lot of cases for us. It can protect us. It's when it becomes too extreme and affects our lives in a negative way, that's when we have to intervene. So let them know it's normal. Always encourage open communication, guys. You know that I'm a proponent of this. So always let your kids know that they can come to you with anything and that they can talk to you without fear of criticism, judgment, or being dismissed. They're so much more likely to talk to you and maintain a reciprocal, engageable conversation if you don't do any of those things. Open-ended questions, that's a big one in behavioral health. So when you talk to your kids, try not to ask them questions where they can answer yes or no. So basically, Do you feel anxious? Is a yes or no question, as opposed to what's been going on lately? How you been feeling? How's school? What's happening in your life? Right? That's an open-ended question. So try to ask more open-ended questions and let them talk, as opposed to asking closed-ended questions where they're just going to shut down with a yes or no. Children look to you as a mentor, believe it or not. Even adolescents that think you know nothing as a parent, and I'm going through that phase right now because I have some adolescent kids. Share your experiences with your children, because even if it doesn't seem like they're paying attention, they are paying attention. So always using your own life experiences and talking to them in a non-judgmental way will certainly be helpful to open up those lines of communication, because it might make them feel more understood and might lead to further conversation and dialogue, which is exactly what you want.
I need you to hear this. You are still you.
There are a couple of things, even if you're not a behavioral health professional. So for example, it's not a bad idea to teach some coping strategies. If I feel anxious, I'm gonna take a break and I'm gonna go for a walk. If I feel anxious, maybe I'll go to the gym and get a workout in. If I feel very nervous or anxious, maybe I'll go through breathing exercises and take some deep breaths. So if you as a parent have some coping strategies that help you, share it with your children. It might help them. And then finally, if this is something that you really think is a problem, see a behavioral health professional. We're trying to reduce stigma in mental health, and it's completely normal to see a behavioral health specialist. And I always say that mental health is just as important as physical health. So if you think there's a problem, psychologist, psychotherapist, social worker, counselor are all really good options to start with. Thank you so much for watching. Click here to subscribe and click here for more.